My name is Ahmed Elneweihi. I am an electrical engineer. I was working for BC Hydro.
My name is Elneweihi. I study psychology at SFU and I work at London Drugs part-time.
The story goes back to 1997 when I discovered that I had hepatitis C and liver cirrhosis.
I think anyone can suffer from liver disease, and everyone out there may need a transplant at some time.
And then all of a sudden in 2008, May 2008, a tumor appeared. The test showed that there is a tumor. And it disappeared for about a year and a half, and then it reappeared again. And then I exhausted all other avenues for getting rid of these tumors. And the only avenue left was a liver transplant.
The transplant unit in VGH is small in the numbers of beds, but we do take care of large population of patients.
And then I find that my kids, all of them volunteered to give me, part of their liver, which, put me in a very difficult situation because I didn't want to have any risk for them, All of them went for blood test.
They all got tested at the same time, but I was working that day, so I had to do mine later. And so their results all came first too. And so by that time, we knew that none of them were a match and we were just waiting for mine.
The blood test came to show that only Samir have the same blood type like me. So he's the only one who can do it. I still was struggling back and forth, whether I should or not have, my kids doing that for me. And then it is their positive thinking and push for me that I decided maybe I should do it.
The first couple of days, everybody is extremely anxious because the day is coming. It's going to all happen tomorrow.
We have to deal with lots and lots of people, lots and lots of problems. Everyone's different.
I understood the procedure now during the day of the operation was that they will open me first. We will be in two adjacent rooms, Samir and I, but they will open me first to make sure that my liver from inside is the same like the tests have shown.
I always tell my patient, you started a journey and the road will not be a smooth one. I always say there will be a gravel, but there will be also rocks and stones, and we'll get you to the end of the road. You might not enjoy it. It will not be enjoyable to be in hospital and have pain and have tests, but we'll get you to the end.
The first day I couldn't stand up without any help, or sitting was difficult, but I started feeling a bit better a couple of days later, and then I was out of there in around 10 days.
So in the first 17 or 18 days, I really had a very rough time.
His recovery wasn't the easiest. He had complications.
Pain and not sleeping very well and all that stuff.
Whenever he's having the bad days, it's important to try and keep him hopeful, try and get his family involved in the care.
One of my daughters was in charge of scheduling everybody to come from 8 to 2, and then the next one come from 2 to 8 and so on. And every night there was somebody there with me.
His family were excellent. I remember his wife and her sister used to come in every day and look after him.
Then I started to feel inside, some improvement after about 2 weeks and a bit.
To see that amazing change in their body, how they recover, and how they can go back to their regular life, maybe in a month or in a year, that's such a gain for not only for the society, for the families, but the society as well.
And that was confirmed when Chris came to me as a nurse one day and he said, I feel that you have turned the corner.
He got out on the 22nd of December, so just in time for Christmas.
So that was a happy occasion that we are all together after the surgery, and I've survived the surgery, and I'm back home with celebrating a Christmas dinner.
I can't imagine what would have happened if we weren't able to have done this.
And of course, I'm grateful to my son for having made this donation. During my stay in the hospital, Dr. Scudamore came once to me and he said that he can declare that my surgery was perfect. And the nurses, their smile, their support, their care.
I'm privileged to be mentioned and to be remembered as a nurse, which maybe change somebody's life or make his day more enjoyable.
From the old country, we say that nurses are the angels of mercy.
If people give money for research, we can actually find a cure for this disease.
It is a good thing to donate, so that one day when you need this kind of care and cure, then there might be things that would not have been available without your donation.